Hi guys, it's Gabrielle. I'm going to be going over the limited OB protocol. So for our first image we'll take is of the cervix, which you can label CX. It's going to be a sagittal image with and without measurement. This image is the one with measurement. So for these images you can use the same one without and then measure with. So you're going to evaluate the length, the relationship to the placenta, and obtain landmarks, the internal os and the external os. So when we measure, we're going to measure at the internal os all the way to the external os. This is the cervical canal. This is the vaginal canal. This is maternal bladder. And this is fetus. I just took out a label, so don't mind that. So for the cervical length, we want it greater than 25 millimeters or 2.5 centimeters. The next image we're going to take is the lower uterine segment, which you can label LUS. So in the LUS image, you know you're at the right position when you can visualize the mother's bladder and cervix. You then want to visualize what part of the baby's body is by the cervix. Head, meaning cephalic, baby's bottom or feet, breech, and body means transverse. So when we look at this image here, we see baby's head, we see some shadowing out, but we see maternal bladder, we see the vaginal canal, and we see cervix. So in this image, seeing that we see the bladder and cervix and the head by both those two, we are going to think cephalic. So you would label this image LUS cephalic. Next is the placenta, which can be labeled PL sag and then PL transverse. So for this, you want to be sure you image the entire placenta in sag and transverse. You will also take note of the placenta location. So these are sagittal images of the placenta. You want to get that edge of the placenta, and then you can see a little bit of body. And then in this image, you can still see that edge a little bit, but you see that body, and you may want to say that you see the edge of the other end of the placenta, but we're trying to look at the entire placenta to make sure everything looks okay. So you want to stretch that out. So in this image, I stretch out that placenta so that we could see that edge so much clearer. So in this image, we can see placenta, we see baby, we see amniotic fluid and uterine wall. Again, placenta, amniotic fluid, uterine wall. See placenta, amniotic fluid, and uterine wall. So sagittal and transverse, you can take 1 to 3 images as long as you show that entire placenta. For these images, I definitely would have changed the gain. It is way too bright for these pictures. So these are my transverse pictures. For this one, we can see that edge of the placenta, some of that body. And then in this image, we see that body really well, and then we can see the edge. So I was able to stretch the placenta out and get it in 2 images, which is okay. So again, we see that amniotic fluid, we see baby, placenta, and the uterine wall. We see a little bit of baby, placenta, uterine wall, and amniotic fluid. And again, I would change the gain on all of these images. And for the location of the placenta, this placenta is posterior because it's on the posterior wall. So on here, it'd be anterior. So when we're also looking at the placenta, we're also going to look at the cord insertion at the placenta. So here we see placenta, we can see that cord insertion, and this is where it'll go and connect to the baby. We see amniotic fluid, and we see the baby. So you want to see the cord insertion centrally located in the placenta. That's not always, it's just the best. Sometimes you see it off to the side. You just don't want to see it on the very end of the placenta. Next is the heart rate, also seen as HR. We do not have to label for measurements because we will be putting them in a package. So for heart rate, it should always be seen when the crown rump length is greater than 7 millimeters. The normal heart rate is 120 to 170 beats per minute. Less than 80 to 90 beats per minute is bradycardia. Greater than 180 beats per minute is tachycardia. When measuring the heart rate, you want your cursor to go through a ventricle and an atrium of the heart. You also want to do this in a transverse view. When measuring the heart rate, we use M mode for less than 27 weeks and pulse Doppler for greater than 27 weeks. So this image you do not have to take. I just thought this would be helpful to blow it up a little bit. So here we see the heart, and we can see aorta and spine, and again baby's abdomen. So we know this is the left side of the heart because it's the closest to the spine. So it's closest to the spine, so we know this is the left side. So we know this is left atrium, right ventricle, and left ventricle. So again, like I said, you want your cursor to be going through an atrium and a ventricle. So when we go over here to this image, this is what your image should look like. You're going to have your cursor going through an atrium and a ventricle. And on this machine, I'm not too sure where they measured, but I would measure from here to here if you didn't have to skip one. But if you did, you'd go from here, skipping this one, to here. And they got 149 beats per minute. Okay, next is the abdominal circumference, also seen as AC. You're going to measure the abdominal circumference on a round transverse image from posterior to anterior on the fetus, at the level of the stomach, and at the level of the portal sinus. Sometimes the adrenal glands are visualized, and that is okay. You want to make sure you measure tight to the skin line. Do not include kidneys. You do not want your kidneys in the image. So when we look at this image here, we see spine, we see stomach, we see the umbilical portal vein, we see ribs. So when you're measuring, you measure from posterior to anterior. So spine, we're going to go posterior to anterior. You're going to open it up, and you're going to make sure you measure tight to that skin line. So this is a good abdominal circumference image. When we look down at this image, this is not a good image. We see kidneys, which do not include kidneys in your abdominal circumference image. We see the spine shadowing out. We can't analyze what's going on in the abdomen. So this would not be a good image. But we can see that amniotic fluid, and this could possibly be baby's stomach. The abdominal circumference measurement is the least accurate for fetal age. Alright, so are these images acceptable for abdominal circumference? We look down at this image, we see baby's stomach, you see the start of the umbilical vein, portal vein, we can see the spine here, and this right here is not the kidneys, it is actually the adrenals, which is okay. So this would be a good image for the abdominal circumference. Just the gain could be fixed. On this image, I actually took this image, and this would not be an acceptable abdominal circumference image. We don't see the stomach, we don't see the umbilical portal vein. This could possibly be kidneys coming in, it's not too clear. We see the spine, and we see those ribs, but this is not accurate. We do not see our landmarks that we need. Okay, next image is going to be femur length, or FL. The femur diaphysis length can be reliably used after 14 weeks. You want to exclude the distal femoral epiphysis. It should be measured when the femur is flat across the screen. You want to measure the femur that is side up and measure from mid to mid. So in this image, we see the femur. This is also a little leg right here, but we're going to measure the one that is side up and flat across the screen. So you want to measure the femoral diaphysis, which is meaning from mid to mid. You don't want to include the distal femoral epiphysis. So we can also see some amniotic fluid and placenta, and we see another little lower extremity. Next is going to be the biparietal diameter, BPD, and head circumference, HC. So you want to measure the biparietal diameter and head circumference at the level of the thalamus and at the level of the cavum septum pellucidum, or columns of the fornix if CSP is not well visualized. You cannot have cerebellum in the image. So for BPD, you measure from outer edge of the proximal skull to the inner edge of the distal skull, perpendicular to the sagittal midline, straight across the thalamus. For HC, you measure from outer skull to outer skull. The measurement can be taken on same image as BPD. So when we look at this image here, this is what we're looking for. We're looking for those landmarks, the CSP, thalamus, and midline falx. So we can see CSP, we see thalamus, we see the third ventricle, and we see the calvarium, which is around the baby's head. So for BPD, we're going to measure from outer to inner, and then for HC, we're going to come up and we're going to go from outer to outer, and we're going to pull that open, and we're going to measure it around the baby's head. So in this image would not be a good image for the BPD and HC because of right here, which is not supposed to be in the image. This is the cerebellum, so this would not be a good image. Next will be the bladder, and the bladder with color Doppler demonstrating 2 umbilical arteries. So it should be routinely seen by 16 weeks and constantly changing size because baby voids and then they refill their bladder. So this is baby's bladder. This is baby's abdomen, and we see amniotic fluid and the umbilical cord. So you can use the exact same image. We want to see a 3-vessel umbilical cord, 2 umbilical arteries, and 1 umbilical vein, and you're going to label it 3-vessel cord. So we see it splitting like a wishbone. We want to see it on both sides. We see 1 artery and the other artery. And again, bladder, baby's abdomen, amniotic fluid. Okay, so now I'm going to explain fetal presentation. So there's 2 steps. Step 1, we're going to check is if the probe is transverse and the image is transverse, it equals fetus is always cephalic or breech. If the probe is sag and the image is trans, equals fetus is always transverse. And if the probe is trans and the image is sag, equals fetus is always transverse. So if the probe and the image are the same, they'll be cephalic or breech. If they are different, if the probe and the image are different, it'll be transverse. So step 2, if the fetus is long, meaning cephalic or breech, and the stomach is at 3 o'clock, that means the fetus is cephalic. If the fetus is long and the stomach is at 9 o'clock, equals fetus is breech. So if the fetus is transverse and the stomach is at 3 o'clock, the fetus is transverse with the head to the maternal right. And if the fetus is transverse and the stomach at 9 o'clock, the fetus is transverse with the head to maternal left. And I'm going to show you some examples. Alright, so probe is transverse, image is transverse. We know baby is cephalic or breech. Now we look at the stomach and where it is. So spine is 12 o'clock. We're going to go around the clock, and the stomach is at 9 o'clock. So stomach at 9 o'clock, we know baby is breech. So this one, the probe is transverse. We know the image is sagittal. So we know baby is transverse. Now to know where the baby's head is, we know that this is mom's right, we know that this is mom's left, and anterior and posterior. So we know that the fetus's head is on the maternal left. And these are my references. Thank you.